Welcome to another More Than Medicine podcast with Dr. Simone Josey, author, speaker, and physician. Listen in as Dr. Simone shares real-life, practical, everyday survival tips for all healthcare professionals. Let's join Dr. Simone now.
Hello, healthcare professionals. Dr. Simone here with another More Than Medicine podcast. Welcome back to all my returning listeners. Thank you so very much for your continued support, for the listens, for the sharing, and for commenting. It means so very much to me. I do this podcast for you, so it's always great to get feedback. And also, I want to welcome my new listeners. I am so happy you decided to tune in today. I have some really great information that I'm going to share with you. And I urge you to listen to the previous podcasts because we are now on podcast number 19. Woohoo! Now, before we get down to the information for today, just take a moment and turn on your notifications for this podcast so that you see whenever I post new content. Now, every Wednesday morning, I have new episodes for you, but I don't want for you to miss out. I have pages and pages of information, and I have some really great guest speakers lined up for the upcoming podcasts. So I want for you to stay tuned and stay connected. In the last podcast, I let you know that I am working with small businesses as well as financial sponsors, and I'm happy to say that this podcast is getting more and more traction and that my marketing team is already working on the first batch of sponsorship applications. That being said, if you are a small business owner, whether it's a medical brand or not, and if you're interested in getting your brand information out to a developed market that is growing daily, then please let me know. I am always available all over social media, and my contact information is more than likely going to pop up here on the podcast. And it's definitely in the podcast episode notes, and I'm pretty sure it's in every episode before this. My goal is just to help doctors and nurses and medical assistants and PAs and healthcare administrators and other paraprofessionals survive the field of healthcare. We know that our lives are more than medicine. It's not just the diagnosis and the treatment, the injections, the surgeries, billing and coding. We know that our lives are so much more. And because of that, we face some really unique life circumstances. Medicine can be stressful. I'm just going to come out and say it. Medicine can be stressful, and oftentimes it's not because of the actual medical science itself. Now, I'm a surgically trained podiatrist, and the hardest part of my practice experience has not been a 3-hour flat foot reconstructive surgery or the severely angulated bunion deformity that does not seem to want to reduce in the OR. It has not been the recalcitrant heel pain that seems to respond to absolutely nothing. To be honest, for me, it has been all of the little things, the non-scientific stresses that I've had to deal with, and that has really made medicine difficult at times. I'm also a mother. I'm a wife, I'm a professional speaker, and I have had to learn how to develop a healthy work-life balance and how to not take myself too seriously while being a strong leader at work and yet coming home and being a good partner to my husband. I've also had to learn how to navigate the tumultuous waters of the good old boys club and racism and ageism and flat out disrespect from some of my coworkers, and all without losing my cool. And let me tell you, it was not always easy.
Dr. Simone Josey is a practicing physician, thought leader, professional speaker, and consultant for leadership, professional development, and customer service skills.
Alrighty, healthcare professionals, welcome back. Believe it or not, healthcare professional, you are in the business of sales, because even though your patient is coming to you and they clearly want your help, you still have to sell them on the idea that, number one, you're competent, and next, that you are truly interested in them getting better, and number three, you have to also sell them on whatever lifestyle modifications or whatever medications they need to take. So it's more about having to persuade our patients. And for me, that's what patient engagement is. Now, my background is in inspiration and motivation, and so it's a concept that I can easily marry. But not all healthcare professionals look at it that way, because my scientific side of my brain is definitely all about pounding the hard facts. Like, why would you not understand that an elevated blood sugar can cause this problem in your endocrine system and can cause this problem in your neurologic system and so forth? But for our patients, they don't quite make that connection all the time. So, let's say, for example, as a podiatrist, I see quite a few diabetic patients in my practice. So, let's say there's a gentleman with an HbA1c of 11. He is on insulin and he has even had one or two infected diabetic foot ulcers. But he still does not seem to grasp the importance of healthy eating choices, using proper shoe gear, staying active, smoking cessation. And these are all modifiable risk factors, right? So he says things like, "What's the harm? It's just a little sugar, doc." Well, in those cases, I like to inspire my patients to recognize what the possibilities are. How can you inspire someone who has heard all the medical reasons and cautionary tales from the textbook, from the pamphlets in your office? Well, you can make a reference to another patient, and it can be your patient or otherwise, who did not take heed and all the negative outcomes. Fear is a good motivator. The word amputation is almost like a swear word in my office. It's like the Grim Reaper, okay? So that's step one. Then step two is inspiring my patient to have an active interest in his own health. Now, some of you might not be able to swing this approach as much as others, but I am a professional and I know that patients are people who are ill and that illness can cause unwanted lifestyle changes. So maybe he is not worried about losing his foot or even having a BKA, because maybe his brother had one and he's doing just fine. That's when I ramp up the stakes. Sir, did you know that your uncontrolled diabetes can lead to impotence? And at that point, the room usually falls silent. Now, don't think this is a game to me, because it's not. Their lives will be affected by the choices they make. We have to make it personal, not just some commercial with perfectly scripted, fictitious patients who look jolly and happy as they take yet another new diabetic medication. Sometimes I point out the fact that if treatment plans and interventions are not followed, they could risk losing precious time with their friends or their grandchildren. Here in the South, most of my patients love to hunt and love to fish, and it's really hard for them to stay for hours in a deer stand hunting deer if they are an amputee. It's not impossible, but it does make it a little more cumbersome. The way I see it is that if journal articles and crisp trifold brochures don't inspire my patients, then it's up to me to reach them. A few years ago, I had a patient who was presented from the ER, and she came to me. Actually, I think she had gone to the ER because her pain was increasing, but she was 4 weeks out from a missed Lisfranc fracture. Now, those of you who have an orthopedics knowledge, or if you see Lisfranc fractures often, then you know that they are one of the more commonly missed fractures. And because of that, by the time a patient comes to you 4-6 weeks out, usually the deformity has already begun to set improperly, and then the pain is increased. So when she came to me, she was a chain smoker, and of course her pain was severe and her foot deformity was getting worse. She had no intention of giving up cigarettes. She was, I'm pretty sure, in her mid-50s, and she had been smoking for many years. According to her, every doctor had told her to stop, and she could quote every tobacco cessation pamphlet. But she did not quit. She wasn't interested. And then she met me. Now, I'll be honest, I can't recall every specific detail of our initial conversation, but I do know that I was able to inspire her to recognize and take an active interest in her health. I simply pointed out the picture of life with a poorly healed fracture or life with a poor surgical outcome, and how her continued smoking was going to prevent her from living the life she was living before her injury. I only agreed to do her surgery once she agreed to stop smoking. So long story short, we did the surgery, she healed well, and she got back into her regular pre-fracture shoes. Now, I, of course, did all the necessary follow-up to ensure that she was holding up her end of the bargain. And of course, it was a gamble, but it paid off. And that is when I realized all those years ago that it was the human connection. It was making it personal for her. That is what made the big difference. I also recall giving her encouragement all along the way. And that is something that I do with most of my patients. Your patient likes to know that you, as their healthcare provider, you have faith in them, even if they don't have faith in themselves. And I even recall challenging her to be a better version of herself, to treat her body better. And it sounds like a bunch of inspirational Tony Robbins type, Jim Rohn's type stuff. But you know what, Doc? You know what? Healthcare administrator, that's what we do on a daily basis. If we can't connect with our patients on a human level, on a personal, intimate, inspiring level, then we are no different from just the black and white textbooks that we read about. And there is a diagnosis, and there is a code that goes along, and there's a billing code and procedural code. But what differentiates us from just the black and white knowledge is being able to look into our patients' eyes and to truly inspire them to be engaged, to be active, to want to make a change. So what am I saying? In short, facts and pamphlets are just not sufficient. Healthcare professional, we have to make it personal, and we have to make it matter to our patients. So that's what I have for you. I hope you enjoyed it, because I enjoyed sharing the information. So be sure to share this podcast with your coworkers, because we all know someone who can use this information. Alrighty, until next time, thank you so much for listening, and I am Dr. Simone, and I will either see you at the top or from the top. You decide.
To join Dr. Simone's exclusive email list, visit drsimonesays.com. Your information is never shared, and we at Dr. Simone International respect your privacy. To find out more about Dr. Simone's programs and upcoming events, visit drsimonesays.com.